Congratulations on your pregnancy. This can be one of the most exciting times in a woman's life. It can also be a time when you have questions about the health of your baby and the testing options available to you. Most pregnancies result in the birth of a healthy baby. However, it's common for doctors to discuss risks for birth defects and genetic disorders with all their patients. The chance for a baby to have a genetic disorder differs based on the parent's age, family history, and other factors. In the general population, each pregnancy has an average risk for major birth defects of 3%. You should speak to your doctor about your specific risks. You may find it helpful to learn more about the health of your baby before birth. This video will give you information about some of the testing options that look for genetic disorders and birth defects. If you're interested in genetic testing during your pregnancy, for many disorders, there is usually a choice between two types of tests, a screening test or a diagnostic test. A screening test is typically performed on a blood draw from a patient's arm. It will check for clues or markers of a genetic disorder and give you a better understanding of the chance for your baby to have that disorder. For many patients, one of the important benefits of a screening test is that it poses no risk to the pregnancy because the testing is performed on a sample of the mother's blood. The results of a screening test allow you to know if your baby has a higher or lower chance for that disorder, but a screening test cannot give a definite yes or no answer about whether your baby has the disorder. Most screening tests are available for twin pregnancies, but may not be able to test for the same conditions and may be less accurate. If you're carrying twins, you should discuss the benefits and limitations of screening with your physician. If you prefer a more definite answer than screening can provide, diagnostic testing may be right for you. A diagnostic test can tell you whether your baby has certain specific disorders. To do this, a sample of amniotic fluid from around the baby or a sample of tissue from the placenta is required. Therefore, diagnostic testing involves a medical procedure that poses a small risk to the pregnancy. Let's look at some of the screening and diagnostic tests in more detail. Some of the most common types of genetic disorders tested for during pregnancy are chromosome disorders. The chromosomes contain all of our genetic information. 23 pairs of chromosomes, 46 chromosomes exactly, is the normal number in every cell of our bodies. The X and Y chromosomes are the sex chromosomes because they determine the sex of the baby. When the Y chromosome is present, it's a boy. Chromosome disorders are conditions that occur when a baby has extra or missing chromosome material. These disorders vary widely in severity, but many chromosome disorders cause intellectual disability, formerly called mental retardation, and/or may cause birth defects. While having a baby with a chromosome disorder can happen at any age, the risk becomes a little higher as a woman gets older. Down syndrome is one of the most common chromosome disorders and is caused by an extra copy of chromosome 21. People with Down syndrome have varying degrees of intellectual disability, specific facial features, and may have other health and physical problems. Other disorders, like an extra chromosome 18, called trisomy 18, or an extra chromosome 13, called trisomy 13, are less common but more severe. An extra or missing sex chromosome can also occur and typically causes milder physical symptoms, which are often not noticeable at birth, like infertility or a hormone imbalance. An extra or missing sex chromosome is unlikely to cause intellectual disability. Chromosome disorders do not usually run in a family, so testing for these disorders is usually offered to all patients. One screening option for chromosome disorders is called non-invasive prenatal testing, also referred to as cell-free fetal DNA testing. This screening test is referred to by many different names, but we will refer to it as NIPT. NIPT can be performed on a sample of the mother's blood as early as 9 weeks of pregnancy. The test looks for the most common chromosome disorders, which include Down syndrome, trisomy 18, and trisomy 13. Some versions of the test can screen for other types of chromosome disorders and can also tell the baby's sex. NIPT measures cell-free fetal DNA, which is DNA from the baby's cells that is found in the mother's bloodstream during the pregnancy. There are several different ways that NIPT can check for extra or missing chromosomal DNA. Speak with your doctor about the available choices for NIPT. A negative NIPT result means that the chance of the baby having a chromosome disorder is reduced, but is not zero. However, NIPT is a screening test, and with any screening test, there is the possibility of a false alarm, in which the results say the pregnancy has an increased risk for a disorder that the baby does not have. For this reason, diagnostic testing should be discussed with women who have a positive NIPT result. NIPT does not screen for neural tube defects, so your doctor might recommend additional blood testing or an ultrasound later in the pregnancy to check for those defects. Another option to screen for chromosome disorders is called maternal serum screening. Depending on when it is performed, it can also screen for neural tube defects such as spina bifida, which occurs when the skin and bone don't close properly over part of the spinal cord or brain. Maternal serum screening is a blood test that measures the amount of certain hormones and proteins that are found in the blood of all pregnant women. When a baby has Down syndrome, trisomy 18, or an open neural tube defect, there can be more or less of these hormones and proteins in the mother's blood. Based on the amount of these substances, the risk for these disorders can be estimated. The levels can also be used to alert your doctor to other possible risks for the pregnancy, including miscarriage or slower growth of the baby. Maternal serum screening can take place in the first trimester, second trimester, or a combination of both. During the first trimester, you may have blood drawn for maternal serum screening between 11 and 14 weeks. Depending on your doctor's recommendation, this first trimester test can also include an ultrasound to measure the back of the baby's neck, called the nuchal translucency. First trimester screening cannot detect if babies are at increased risk for open neural tube defects. During the second trimester, the blood for maternal serum screening can be drawn between 15 and 22 weeks gestation, and the screening can also look for open neural tube defects. Your doctor may offer you the option of either first trimester or second trimester maternal serum screening, or a combination of both. Results of a maternal serum screening test are given as either screen positive or negative with a risk level. If the risk is below a certain cutoff, the results are said to be screen negative. While this is not a guarantee, it does mean that the chance of the baby having the disorder is considered low. If the test results indicate a risk above a certain cutoff, the results are said to be screen positive. This does not mean that the baby has the disorder, but that further testing should be considered. Let's look at an example. If a maternal serum screen result estimates the chance for the baby to have Down syndrome to be 1 in 100, it will be considered a positive result. The result is actually stating that out of 100 women with a similar result on the blood test, one of them has a baby with Down syndrome. As a percentage, this is a 1% chance. That means there is still a 99% chance that the baby does not have Down syndrome. So while that risk may be higher than expected, it doesn't mean that the baby has Down syndrome. Patients with a positive maternal serum screen result will be offered further testing options. Diagnostic testing may be right for you if you would like more information than screening tests provide. Diagnostic testing provides answers regarding whether there are chromosome disorders by examining the baby's chromosomes, so that both common chromosome disorders like Down syndrome and more rare chromosome disorders may be found. In order to analyze the baby's chromosomes, a sample from the pregnancy must be obtained. There are two types of procedures that can be performed: CVS or amniocentesis. CVS stands for chorionic villus sampling and involves taking a small sample of the placenta under the guidance of ultrasound. The sample is sent to a lab where the chromosomes in the cells of the placenta are examined. Because the placenta and the baby develop from the same fertilized egg, they should have the same chromosomal makeup. The procedure may be performed through the patient's cervix or abdomen, depending on the position of the placenta, and is available between 10 and 14 weeks. CVS cannot test for open neural tube defects. An alternative diagnostic procedure that you may consider is amniocentesis. Amniocentesis involves obtaining a small sample of amniotic fluid by inserting a thin needle through the mother's abdomen. Like with CVS, ultrasound is performed during the procedure to guide the physician in placing the needle. The amniotic fluid contains some of the baby's cells, and the chromosomes from the cells can be examined in the lab. The amniotic fluid can also be used to test the baby for open neural tube defects like spina bifida. Amniocentesis is usually available after 15 weeks. Although CVS and amniocentesis are routine procedures, each involves a small risk of miscarriage, less than 1%. If you're interested in having a diagnostic procedure, you should talk to your doctor. Keep in mind that all tests and procedures discussed here are optional, and all decisions about prenatal testing are entirely up to you. As you consider your testing options, remember that most pregnancies result in the birth of a healthy baby. But no test can check for everything, and no test is perfect. Talk with your doctor or genetic counselor about your testing options and any concerns you have. We hope that by understanding what tests are available to you, you'll feel confident that the test you choose is right for you and your family. Best wishes for your pregnancy.